Welcome, everyone, to A Mexican Crossing Lines with your hosts, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You're listening to 88.1 FM, KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. And tonight, I'm going to be talking about how the states are faring, how people and businesses are faring across the country with the reopening, and also touch on the hearings that were taking place today with the head of the CDC, the Dr. Fauci, and others testifying before members of the House. The Senate, excuse me.
Mm-hmm.
It was very interesting to hear some of that testimony that was given. And from what I could gather, all of the experts that were being questioned, they had a pretty grim report of what will happen to us if we reopen without all of the safeguards in place. So we're going to talk about that and how, for better or for worse, America is charging full speed ahead. That's the title of my show tonight. So, it's messy. It's not looking very good for some states that are already having hotspots emerge. And we'll talk about some of those states and what's going on throughout the world, all on tonight's show. But first, I want to thank all of my followers and listeners for choosing 88.1 FM and my show, A Mexican Crossing Lines. You can listen to a variety of programming locally on the radio. You can also follow us on social media. And of course, we would always love for you to support this station with a tax-deductible donation.
Oh, yeah. Thank you, friends. Welcome, all friends. Pleasant evening. It's good to be back with you. It gives us a sense of normalcy because we do shows every day, but we have to look at all the facts and be up on speed on what's going on. And we really appreciate that people send us information and connect with us. And there's many ways you can do it. If you'd like to give a call and just leave us a voicemail on our voicemail, it would be 701-566 0917. It's 701-566-0917. You can email Cindy at kpppfm.com or me, Duke, at kpppfm.com. Find us on Facebook at 88.1 FM Fargo Moorhead, Mexi-Can, and the People's Press Project. And over at YouTube, it's under Duke 1517 is our YouTube channel. We're simulcasting on both YouTube and Facebook, and welcome to both communities. Also, check out our website at kpppfm.com, and you can look around, see our programming, and also make a donation. As Cindy said, just go to kpppfm.com/donate. Makes a tax-deductible donation to help keep our station going. And a little tidbit for this Saturday night at 7:30. There's a local musician named Michael Pink. He's been doing live concerts, and he's really, really good. He's got good equipment, and it sounds really good. We're going to pipe his concert on to 88.1 FM radio. So it plays on the radio as well as when he's playing it on Facebook Live. So it's a show that I don't know how often we'll do it. If we can do it every week, we will. And so we appreciate the musicians in our community.
Very much. It's going to be a great concert. So I hope folks tune in for that. And I mean, it's going to be a lot of fun. Hope you guys check it out. Let's go to our world numbers. Currently, we have total confirmed cases of COVID around the globe of 4,255,194. Interestingly, right now, Russia is right behind the United States and now topping 232,243 cases. Spain is right behind Russia at 228,030 cases. We now have 291,366 deaths globally. And here in the United States, we have now topped 1,408,073 coronavirus cases, with 83,368 deaths and 295,777 recovered people.
Wow.
And, you know, just because the curve is flattening in some places, like, for example, in New York, they are still having a lot of cases, 1,504 new cases for New York since yesterday, and 172 new deaths. New Jersey had 942 new cases and 200 new deaths.
Wow.
So even in places where their numbers are going down, remember when they had 700 and some deaths per day?
Yeah.
Obviously, their numbers are far, far down from that. But then again, we are now finding new illnesses associated with COVID, like the Kawasaki-like disease that is afflicting children. So there are great concerns about reopening of schools, as well as reopening of places where folks gather, like parks and events like parades, etc. It'll be very interesting going forward in the next couple of weeks and in the next couple of months to see how we fare. What's it like here in Minnesota?
Well, in Minnesota, it's not good. It keeps going up. I got the information from the state's website today, and that the total positives are 12,494, and the number of healthcare workers that have COVID are 1,436. There's been 614 deaths in Minnesota, and the majority of them are from long-term care assisted facilities. 501 people out of 614 have come from basically the care facilities, and that's way too high. It's very unfortunate. And I'll bring other breakdowns. And also here in Clay County, the county we live in, there's 254 cases. That's been going up, and there's 17 deaths. And that, again, is very unfortunate. And that's the area we live in. Now in Fargo, or actually North Dakota, two people died in the past day. A woman in her hundreds from Cass County, and a woman in her 70s from Cass County. And there's positive cases, 44 were Cass County. The total numbers, positives, 1,571 total positive cases. And
that's up 53 from yesterday.
53. So it's like, it's bad. It's bad. And again, North Dakota is opening more and more, and just total disregard, I think, for social distancing. There's some golf tournament going on today, and they're at the country club in Fargo, and it has
Josh Duhamel.
Yeah, it has celebrities in it, but no one's wearing masks. They're close together. There was 9 news crews out there.
Oh my gosh!
Not a single mask. Everybody's close together.
They were interviewing them close up.
Right close up, and I thought, look at the numbers. They go up, especially the county you're in. You're in the county. That's the worst county for positive cases in the state, and you're running around like, there's no concern.
Yeah, well, maybe there isn't for them. One of our listeners, Joseph Yericha, comments, y'all need to remember these federal researchers, doctors, and PhDs are actively trying to recruit people of color to biomedical research that will make big bucks. Where are these guys now during the COVID crisis?
That's a good point.
Good enough to biomine, but not good enough to save our lives? Remember this when COVID is over. They said back then they wanted to help through life-saving, innovative biomedical research. Now, it's crickets. Very good point. Thanks for your comments. Keep interacting by following us on Facebook or YouTube. And also, you can call into our line. Some people have done that and even sent us messages about their businesses. By the way, I wanted to bring you an update from a local business. Remember, I told you that Vinyl Taco had an article in the HPR and in the forum about how their workers walked out. Well, it turns out the owners were recently interviewed, and they said that not only were they blindsided by the story, that the forum writer, former HPR writer, Chris Hagan, had actually colluded with the workers in order to basically come up with a plan so that they could make Vinyl Taco look bad. The owners called it slander, and at the same time continue to collect unemployment, and even discussions of planning a GoFundMe from the media attention that they would garner. All of this collected in emails or text messages from a joint group among the employees and the writer of the story.
Wow.
Yeah, so very, very interesting developments in terms of how employees and employers locally are dealing with this.
Each other. And also, the story does bring up something I think about a lot is the whole unemployment thing. I mean, you get offered your job back. Say you got unemployment. Say you actually got through that system and got a benefit amount. The federal government gives you an extra $600 a week. So say maybe you get $200 unemployment, you're getting $800 a week. That's equivalent of about $20 an hour job, and you're going to go back to your job for $14 an hour or less. And you're like, wait a minute, come on and work in these hazardous conditions. Here's your job back, and you're like, well, I don't want to do that. Well, you don't have to, but that means that you are disqualified for unemployment. You got to find a job. So it's like you're going to take the job you already had or go look for a new job during the COVID crisis. There's a lot of jobs. I mean, a lot of food delivery, all sorts of jobs you can do that you're, hazardous jobs. But that's something I just think about. I'm not sure what the right solution is. The Democrats just passed in the House another stimulus bill that has a stimulus checks again. There's still people who haven't gotten stimulus checks. There's businesses who didn't qualify or didn't get funding from the first round. They're trying to do an injection, but it's just like, where's it all going to go and how we all survive? I think about that a lot every day.
And speaking of COVID cases that are new, we had heard, and of course we've seen that doctors, nurses, people that are intubating especially, or dealing with very close contact with patients, wear face shields and goggles over their eyes to protect their eyes. And that's because coronavirus, it's now been confirmed, can enter the body through the eyes. Scientists find eye cells are a prime target for the deadly virus to attach to.
Great.
And folks, guess what? They found the virus in the tears. So according to this article, the receptors in the eye, the ACE2 receptors, which are also found in respiratory tracts and the lungs, are found in the eyes as well. And that is where the SARS-CoV-2 virus likes to attach. So it means that droplets that are infected in a sneeze or in a cough, they can land on the surface of your eye. And that also might explain why some patients have suffered conjunctivitis, or pink eye, as we also call it. Not only that, but the virus tears are in the virus. Virus is in the tears, so you can shed and spread the infection through tears. I guess it's just another form of bodily fluids that carry the virus. This is another very interesting development.
They just say don't touch your eyes. So they said don't touch your eyes with your hands.
Don't touch your eyes. And this may be an argument for why people should be wearing goggles or some other kind of eye covering when they're out in public, especially in enclosed spaces. In addition to that, I know that people have heard about this, Kawasaki-like disease that is attacking children, but the details of this have now developed. So we understand that this disease, COVID-19, is attacking in children where this is developing their kidneys, their heart, their nerves. It's not just a respiratory disease, in other words.
Wow.
And, speaking of the nursing home issue, which is rampant across the entire country, the entire world, really, Connecticut is finding a very interesting solution, and I think that other states should quickly follow suit. Take a look.
Has made a bold move, and we got a first look.
Is this standard operating procedure now?
Absolutely. An all-COVID facility for nursing home residents getting out of the hospital.
Nursing homes were like a petri dish for this pandemic. We've had about 50% of our fatalities have happened there.
That number climbing fast. Connecticut's Governor Ned Lamont thinks forcing nursing homes to take COVID-positive patients, as most states are doing, is a path to disaster.
I'm terrified.
COVID-only facilities are Governor Lamont's solution. This was a 90-bed nursing home until it shut down last November. An ideal setting for a COVID-only facility, says Harvard professor David Grabowski.
Connecticut deserves a lot of credit. They're testing everyone, staff and residents. They're providing personal protective equipment for the staff. And then finally, they're creating these specialized COVID facilities.
Over the weekend, New York's Governor Cuomo reversed his controversial policy forcing nursing homes to take back COVID-positive patients and says they now have COVID-only facilities like this one on standby. Back in Connecticut, the National Guard is lending a hand. Like most of the country, Connecticut has struggled with the shortage of PPE, especially for nursing home workers. Some donning trash bags, they say, to protect themselves. Governor Cuomo has said it is not his responsibility to provide PPE to nursing home facilities.
In a crisis, the buck stops right here. And I can sit around saying, oh, these nursing homes are private enterprises. Why didn't they take care of their own people? Forget it. We're in a crisis.
Here, they tell us they have enough, especially as all the patients will be COVID positive. So in other words, you suit up in the morning and you're pretty well set for the day.
Correct.
Meanwhile, one union leader tells us 40% of the staff in some facilities are COVID positive or not able to work due to exposure.
You two have volunteered to work in a COVID-only facility. I mean, how did you explain that to your families?
Because I'm sure of my infection control technique, and I've been doing it for a long time.
Yeah.
Wash your hands, wash your hands, wash your hands.
After doing this for over 15 years, I think we're confident
49
in
years,
our
yeah.
ability. Yeah.
Confident, too, that other states could save lives by creating places like this one. Cynthia McFadden, NBC News.
We should do that.
We definitely should. And I have had a lot of concerns about the rising numbers of staff as well as residents that are becoming sick locally. From the very beginning, I said, as long as they have staff people that are coming and going and coming and going, they're going to be infected at some point. Mm-hmm. And not only that, but if you have people coming out of the hospital recovering from COVID and they just let them back into the general population with the other residents, it's going to spread.
That just happened in Fargo. We've seen 2 newscasts already where someone who was like 102 came back to the nursing home and they cheered and they wheeled the person in, and another person that had an elder that had it moved her right back into the nursing home.
And we've shared the news here that the virus can continue to spread through fecal matter, and it stays in the lining of the intestines for up to 33 days. So I think that this is a good idea. This is an alternative that allows people to basically quarantine all of the COVID recovering patients together. And, the president was asked about Connecticut and asked about whether or not the White House would issue a federal directive from, our executives saying that all facilities are mandated to test all of their staff and residents, which I think is a wonderful idea. I hope the president definitely puts that into place. He asked the reporter, would you like me to do that? I can do that. We would love for you to do that, Mr. President. That would be amazing. During the testimony from Dr. Fauci today with the Senate, he warned that the outbreak could be very, very serious consequences and that it could cause death and suffering if we were to reopen too early. He said, my concerns is that we'll start to see little spikes that might turn into outbreaks. The consequences could be really serious. And he also warned that opening too soon could turn the clock back, and this would, cause some suffering and death that could be avoided, but could even set you back on the road to economic recovery. And that is exactly what I was talking about in a previous show that any policy that doesn't have the health and safety of workers and consumers front and center, at the forefront, is actually going to jeopardize the economy in the long run. Reopening states that are not ready is just really not the way to go. In fact, that was what the president and the task force had advised, that the reopening was to be done safely in a phased manner, and that you would be looking for a 14-day downward trajectory in new cases or positive test rates. Yet many states have begun to reopen and are about to do so, including Alabama, Kentucky, Maine, Mississippi, Missouri, Nebraska, Ohio, Oklahoma, Tennessee, and Utah. And frankly, the truth is that a lot of the states that have opened have seen spikes. More than 2,500 new cases have appeared in Florida since reopening on Monday. The state of Georgia lifted its social distancing restrictions and reopened more businesses despite internal federal documents showing that the state has too few ICU beds to deal with the surge in cases. Governor Whitmer of Michigan asked Mike Pence during those protests that we saw being cheered on by our president, saying that, quote, "We have seen from initial protests here that we've got COVID-19 spreading into rural parts of our state, which people traveled from." So, if these are any of the indicators of what is to come for the rest of the states as they reopen, it's not looking very good.
No.
California, with this in mind, has tweeted that they are sending out PPE, proper PPE, okay, to not just hospitals and clinics and first responders, but to essential workers, to workers. Last week, they delivered more than 11 million surgical masks to schools and educators, farm workers, social workers, grocery workers, and transit workers to get them all protection. Meanwhile, in LA County, the LA County Sheriff's has released video surveillance showing inmates at a jail in Castaic sharing a water bottle and then rubbing the same mask on their faces to purposely infect themselves with COVID-19. And all of this they did because they thought it would help them get release.
Oh my God.
21 people ended up getting infected.
Jeez.
I hope that this is not a trend or some kind of ploy, because it's going to turn out horrible.
Yeah.
Let's read some of the comments. The governor of Texas has ordered all residents to be tested and those positive to be moved into a separate wing or another facility with COVID. Also, all staff tested and temp checks, and he was sending PPE to all nursing homes. Sherry, that is a wonderful news. Lily V says administered USDA emergency food distribution yesterday. Several men mentioning that they were waiting to apply for unemployment benefits. Very, very interesting. And let's take a look at the spike in the heartland. According to unreleased White House reports that show the coronavirus rates have spiked in heartland communities, Trump claims that cases are falling everywhere, in contradiction with his own task force's report obtained by NBC News, according to showing that the virus is spreading far from the coasts. So in states in the Midwest, that's us, we are still awaiting that spike. The top 10 areas recording surges of 72.4% or greater over a 7-day period compared to the previous week, according to a set of tables produced by the task force data and analytics unit. This includes Nashville, Tennessee, Des Moines, Iowa, Amarillo, Texas, and atop of the list with 650% increase, Central City, Kentucky. On a separate list of locations to watch, which didn't meet the precise criteria for the first list: Charlotte, North Carolina, Kansas City, Missouri, Omaha and Lincoln, Nebraska, Minneapolis, Montgomery, Alabama, Columbus, Ohio, and Phoenix. The rates of new cases in Charlotte and Kansas City represented increases of more than 200% over the previous week. And other tables included in the new data shows clusters in neighboring counties that don't form geographic areas of their own, such as Wisconsin's Kenosha and Racine counties, which neighbor each other between Chicago and Milwaukee. And in Detroit, they are setting up this massive hospital inside of a stadium or, some kind of event building. Take a look. This is in Detroit, Michigan.
Well, it's a bunch of, I don't know what material that is. Plastic.
Some kind of curtain that looks like plastic or something.
They're sectioned off into rectangles.
But there's, the air, there's nothing covering, there's not like a roof or something. No. And just look at how many. You see those people walking down the middle row there?
Oh, boy. They're very small compared to the size of all those tents.
It's a lot. Well, today there was a lot of spirited questions from different senators for the task force experts. And this is the question from Tim McCain. Take a listen. This is Democrat from Virginia.
Testing much earlier than the U.S. Now, in the 5th month of the pandemic, we've surpassed South Korea in per capita testing. But in the critical month of March, South Korea was testing its population at a rate of 40 times the testing in the U.S. Admiral Gerard, Dr. Gerard has set out the standard for us. When we get to September, he says the United States needs to do 40 to 50 million tests a month to be safe. That equates to about 1.3 million to 1.7 million tests a day. Yesterday, we did 395,000 tests. We've got a long way to go. A second factor is contact tracing. South Korea embraced a rigorous contact tracing program right from the beginning. The United States still has not engaged in a national contact tracing program. Isn't that right? Would that be Dr. Fauci or Dr. Redfield?
Sir, I think that question would best be directed to the CDC and not the NIH.
When the outbreak started, sir, we had an aggressive contact tracing program, but unfortunately, as the cases rose, it went beyond the capacity, and we went to mitigation. So we lost the containment edge. Clearly,
and that was key to the economy as well, because South Korea did testing, contact tracing, protect, serve, isolate the sick, and then they didn't have to do the shutdowns, which helped their economy. Social distancing is a third factor. We've talked about it, but finally, the last one, healthcare systems. Would you agree with me that it helps keep people safer either from serious conditions or death from COVID-19 if they have access to health care?
Yes, of course.
Of course that's the case. In South Korea, 97% of the population have health insurance. In the United States, before COVID-19, millions didn't have it and lacked access to health care. The massive job losses in the last months threatened to take health insurance away from millions more, and President Trump is doing all he can to dismantle the Affordable Care Act, which would take health insurance away from tens of millions more. Let's learn the lessons from those who are doing this right. Thank you, Mr. Chair. I yield back.
So, did you hear what percentage of South Koreans have health care? 97%.
Wow.
And, as much as Republicans have wanted to get rid of the Affordable Health Care Act, it is something that even during this last election cycle among Republicans was a very important thing to keep. Remember, everybody was saying, including the president, that people that wanted to keep their current level of insurance and health care would be able to do that, that they would protect that they would protect people with pre-existing conditions. So obviously that's very important. I think that among some of the troubles arising for this Trump administration, especially on re-election, is this issue of the Affordable Health Care Act. And this is just probably last week, President Trump talking about getting rid of the Affordable Health Care Act. Take a listen.
What we are doing is we want to terminate health care for under Obamacare because it's bad, and we're replacing it with a great health care at far less money, and it includes pre-existing conditions.
Really?
Well, I mean, it sounds good, but with the rollout of the CARES Act, the rollout of the new unemployment benefits, I mean, and we have existing structures in place to deal with those things, and it hasn't gone very well. I mean, even when they rolled out the Affordable Care Act, there was a lot of problems getting people enrolled. So during a pandemic, is it really the best time to start from scratch?
Yeah, no.
I don't know. There's a lot of questions about that. There's also a lot of questions about what's happening to Russian doctors. Apparently, they're falling out of windows and dying sometimes, and nobody knows why. This particular doctor, Alexander Shulipov, age 37, who's an emergency room physician in Southwest Voronezh. I'm going to murder all these words. Yeah. He fell from a second floor window at a hospital where he worked and where he was himself being treated for the coronavirus, fractured his skull and broke multiple ribs in the fall, but he did survive, according to local reports.
Wow.
Another doctor, Alexander Kosyakin, who's a paramedic, he asked in a video posted on Instagram, what shall we do in such a situation with regard to having to reuse PPE? 3 days later, local news website said Shulipov had recanted the allegations about the reuse of PPE, saying that he and a fellow healthcare worker that appeared in the video had been driven to make those remarks based on emotion. He was reportedly threatened with criminal charges for spreading fake news about the virus, and police are looking into possible causes for his fall. Some reports have suggested he slipped out the window while smoking a cigarette.
Oh, wow.
I don't know. That doesn't happen very often.
No.
Also, the head of the ambulance service, Natalia Lebedeva, for a small town, died on April 24th after she fell from a hospital window. She was also being treated for the virus. Local officials reported it was a tragic accident. Popular newspaper Moskovsky Komsomolets reported, citing that Lebedeva's colleagues, that she might have committed suicide after being accused of spreading the disease. Another senior female doctor, Elena Nepomenayashya, God, I'm terrible at these Russian names, reportedly fell from a hospital window 2 days later on April 26th in the Siberian region of Krasnoyarsk. I'm terrible at this. Excuse me.
Yep.
She died of her injuries several days later. Nepomanyaskaya had spoken out against the region's government plan to treat COVID-19 patients at her hospital, citing a lack of protective equipment, proper training according to local media outlets. Her fall was from a fifth floor window, reportedly following a meeting with regional health officials. There's been no official explanation of how the incident occurred. Russian officials confirmed 10,102 new coronavirus infections today, bringing the total number reported in the country to 155,370. And, you know, there's a lot of videos coming out both in New York and in other big cities, especially with communities of color, where there are violent clashes with police, large crowds being broken up In the video you're about to see, this is dash cam footage that was released by the Fort Worth police. It shows dozens of people scattering as gunfire rings out as authorities try to clear a park crowd on Sunday despite COVID-19 guidelines discouraging large gatherings. 5 people were injured. Take a look.
People are running. There's firing. Bullets being fired. People are going on the ground. They're laying down. Some people are just walking normal. People running.
That's more than a dozen. I mean, that looks
that's a
like
lot.
50 to 100 people.
Yeah. And I don't know who's firing the shots.
I have no idea.
Well,
it appears the police don't know. That was from World News Tonight on ABC. And I wanted to share with you out of the UK, London specifically, a woman named Belly Muhinga, age 47. She was on the concourse at Victoria Station in London on March 22nd when a member of the public who said that they had COVID-19 spat and coughed on her and a colleague. Within days of this assault, both women had fallen ill to the virus. Miss Muhinga, a mother of an 11-year-old named Ingrid, was admitted to Barnet Hospital and put on a ventilator, but died on April 5th. Her trade union, the Transport Salaried Staffs Association, said her husband, Lusamba Goed Katalai, said the suspect walked up to Miss Muhinga and spat in her face. British Transport Police are now investigating, although it is believed a complaint was not registered with them at the time, despite Miss Muhinga and her colleague asking staff and employers at the railway to contact police, said her union. Take a look at this video of her sister and her daughter, Ingrid, being interviewed about the incident.
He started about asking, why are you working? They say we should be on duty. And he said, I think you shouldn't be here. And I have COVID, and then just spotted them too. They were working that day. We're still crying, we're still mourning, especially for the little one here. She won't have her mommy anymore. She won't have her mommy. She always with her mommy. It's just, I don't know what to say. It's just painful.
Wow.
And Belly Muhinga's mother had underlying conditions. She just had a surgery a few years back, and also she suffered from respiratory issues. This is a picture of her. She's very, very young, 47 years old. And, you know, sadly, these kinds of attacks, such a senseless death too, you know, because the guy just felt like he wanted to murder people with his COVID.
Yeah, it's bizarre.
So sick. It's just so disturbing. Well, you know, one of our listeners posted suggestions for what you can do with your stimulus check.
Oh, yeah.
And I think they're pretty good, which is why I decided I would share this with you. Take a look at these suggestions of what you can do with your stimulus check. She posted, if you had to make a suggestion of what to do with your stimulus check, it would be to invest in food preservation tools.
Yeah.
Pressure canner, water bather canner, canning jars, a good food dehydrator, a good freezer, lots of freezer bags, vinegar, citric acid, pectin. I'd also preserve everything you can get your hands on that is still at a good price, because inflation and shortages are hitting at all-time highs. Grow a garden. Get chickens, rabbits, and other meat livestock. I would make sure that your bills are paid up forward and that your vehicle gets its necessary repairs and that you have a hunting and fishing license. If things get tough, then you'll be ready. What do you think? All good ideas?
Yeah.
Food preservation is very important.
Very, very much. And I have a few, I feel like, geez, I need to get a bunch of other things because I have canning supplies. I don't have the pectin. That's great for making your jams and everything. We're starting a garden, but we're not going to have anything that we need for, 60, 70 days probably. Hunting license and fishing license.
Not a bad idea. And also, contact your local farmers, local CSAs. There's probably going to be an expansion of the use of those right now. And that's a great way to get fresh produce and to get it locally. Finally, I wanted to show you kids being disinfected before school. That's the request being made by teachers in the UK as people start to discuss whether or not they want schools to reopen. Teachers there are asking for children to be disinfected with spray before they come into the school.
Wow.
How do you feel about that? I don't know if I want my kids sprayed with disinfectant.
Exactly.
That might not be good for the kids. Well, as we begin to reimagine what the future will be post-pandemic, a restaurant has opened, not here in the United States, but I really like this model. This restaurant is just one table. This is in Sweden. A couple there opened up a COVID-safe restaurant. It's just one table and one chair located in the middle of the meadow. Take a look. Swedish couple has opened a COVID-safe restaurant in a meadow with one chair and one table. There are no waiters. The food is brought to the table in a basket system.
Oh, on a pulley.
There's no waiters, right? You just, a little basket gets on a pulley, goes all the way down to the table. The restaurant is booked out through this month, and the owners plan to continue serving throughout the summer.
Probably expensive.
Yes, but it looks beautiful and also very private and romantic. There's the appreciative customer. What do you think, Duke? You think that might work? I definitely think we have enough space here in North Dakota.
I like the pulley thing. That's actually pretty ingenious. It solves how to serve people, without getting close to them. You just have a rope and a pulley and a basket system where you just goes down the pulley. I like that part.
Yes, it was very interesting. And here is your funny moment of the day. The Legos characters put out a COVID PSA. I thought it was kind of cute. Let's see what you think.
Right.
Darkness has descended upon us. The world as we knew it is over. It is Armageddon, the apocalypse. Everything is not awesome.
Good morning, Lucy. Or, sorry, is it Wild Style again? I can never be sure. Are you here for the Pizzazz?
The PSA, yes, for COVID-19.
Me too. The coronavirus novel. Although I admit I didn't read the other 18 books in the series.
It's a novel coronavirus. Novel just means new, as in it's a virus we haven't seen before, and the 19 is because it was discovered in 2019.
I totally didn't get that, but it does make the rest of what they told me to say make much more sense. They call it do the 5. Hands, wash your hands. Elbow, cough or sneeze into your elbow. Face, don't touch your face. Space, keep a safe distance. And home. Stay at home if you can.
Hands, elbow, face, space, and home.
Exactly, but it's kind of hard to remember, so I came up with sorry, it's no, hold on, I got this. Hands, elbows.
Emmett, come on, it's obviously a song. Which I am not singing. I do not sing.
Not entirely true.
Okay, one time with Everything is Awesome, but that's because our lives depended on it. Which is exactly what's going on now. Ugh, fine. Hands, elbows, face, and space. Stay at home.
Hands, elbows, face, and space. Stay at home. Don't touch your eyes or ears, mouth or nose. Hands, elbows, face, and space. Stay at home. That was awesome. I know, you don't think... No, I was coming for an air hug. It feels so good. And for you kids at home, Air hugs are the best.
Yeah, that felt good.
Oh, boy. Air hugs.
Like the head, shoulders, knees and toes, knees and toes.
Yep, exactly.
Yep. Just same thing, but cuter. Very funny.
Mm-hmm.
And that's all we have for you tonight here on A Mexican Crossing Lines with your host, Cindy Gomez-Schempp.
And Duke Gomez-Schempp.
You've been listening to 88.1 FM KPPPLP Fargo Moorhead, where we are adding local color to your airwaves. Don't forget to wash your hands. Air hugs for everyone. And God bless you. Have a great evening.